Hello and welcome to anatomy tutorial number 7. In this tutorial we'll be talking about the skeletal structure of the upper limb. The upper limb consists of the upper arm, forearm and hand. The upper arm consists of the bone called humerus. The humerus attaches to the glenoid cavity or the glenoid fossa of the scapula. The head of the humerus inserts into that glenoid cavity. The glenoid cavity is not very deep. The groove of the glenoid cavity is not very deep, so that means that this joint, which is called the glenohumeral joint, is not very stable. It does allow for great flexibility, wide range of movements, but because the glenoid cavity is not very deep, the head of the humerus can easily dislocate from that groove, which is why this joint, the glenohumeral joint, is usually very common to dislocate the shoulder because of that shallow groove of the glenoid cavity. Okay, so now we will look at the anatomy of the humerus bone. The humerus consists of the head, which inserts into the glenoid cavity, the anatomical neck in this region, the surgical neck in this area here. I guess they call it the surgical neck because this is where, if it gets fractured, commonly gets fractured here. So head, anatomical neck, surgical neck. You have a greater tubercle and lesser tubercle. Between them is a bicipital groove. Then you have a protrusion here. It's called the deltoid tuberosity. The deltoid tuberosity is the site of attachment of the deltoid muscle. Below the deltoid is a groove, a narrow, very narrow groove that runs along the back and just kind of turns in like a spiral shape, comes from back, goes like this. So it's called a spiral groove or a radial groove because the radial nerve runs through this groove. Then you have when you continue go down, we have a lateral condyle and a medial epicondyle, a lateral epicondyle and a medial epicondyle. You can see that the lateral does not protrude as much outward as the medial. Okay, so the lateral and medial epicondyle. Then there is a site of articulation with the forearm here. There is a capitulum. It's round. It's like a spherical shape. Capitulum. Then you have the trochlea. Trochlea is more like a W on the bottom. And the reason for this, well, we'll get to the reason in a second. Then here is a fossa, surface, kind of goes in. This surface is called coronoid fossa. It is a site where the coronoid process of the ulna meets the humerus when you flex your arm, which I'll show you later. So coronoid fossa. Okay, so the reason for this being a ball shape, the capitulum and the trochlea being this W shaped, is because the radius, the head, is like so. It has a groove on the top, and the head of it is like a like a disc shape. And there's a groove, and that groove will fit nicely right into, and this capitulum will fit right nicely into that groove, as you can see here, like so. And there's the radius, there's the capitulum. Okay, and the reason for this is because the ulna, the coronoid parts of the ulna, is actually also W shaped, like so, so that the trochlea nicely fits into the two grooves of the coronoid process of the ulna. Okay, like so.